This is a lecture on Chapter 5, Diseases and Disorders of the Eye and the Ear. This chart combines the diseases and conditions of two different organs, and the first that we're going to talk about will be the eye. And I've provided this picture on the PowerPoint slide in front of you that gives you a general idea of the basic structures of the eye. And then your textbook does a real good job of showing you the parts. They're labeled on a diagram there. There's a good amount of information in the first couple pages about how the eye works. And you should read over that because it's going to really help to understand light rays and how those light rays enter the eye and how the eye bends the light in the process of refraction. And then the conditions of the ear, you'll see an introduction in part 2 of my lecture about the ear and the parts of the ear. These are the conditions that I will not be covering in Chapter 5. So I'll give you just a minute to look over those and to make notes of those that will be skipped. Okay, we're going to look first at the what's considered refractive errors. Refractive errors that result in the eye being unable to focus light effectively on the retina are identified as hyperopia, myopia, astigmatism, and presbyopia. All of these conditions can be treated by the use of glasses, some form of lens placed in front of the eye, contact lens, glasses, or some of the conditions can be corrected with surgery. Refraction errors. It's all about errors in the way the light is bent to focus it just right on the retina. Again, if you look over the introduction to this chapter and maybe even back to the medical terminology book, like the Language of Medicine, or an anatomy book, to become familiar with how the light waves should be bent or refracted is going to help you understand the refractive errors. The first is hyperopia, which hyperopia is what we refer to as farsightedness. And you can see things far away, but to see things close up, you have to have some kind of correction of your vision, like glasses or contact lens. Hyperopia, farsightedness. The light that enters the eye is focused kind of behind the retina rather than on the retina, and it's very difficult to have a clear view of an object that is close to you when you have farsightedness. You actually see things far away very well. Like you could drive without glasses, but you would need glasses to read things. The myopia is just opposite. Nearsightedness, you can see things close up, but you would need glasses to see things far away. And this occurs when the light rays that enter the eyeball are kind of focused in front of the retina, and again, you'll see things blurry when you're looking at things far away. Next is astigmatism, and astigmatism is kind of a combination there. It's an irregular focusing of light rays entering the eye, caused by the cornea not being exactly spherical as it should be, and the light rays are just not focused properly on the retina. It's the retina that's the layer that has the sensitive cells of vision, the rods and cones. And again, lenses could be used to correct the astigmatism. Now, presbyopia, opia means vision, and presby actually means old age. This is a condition caused by just natural aging, in which the ciliary body, these muscles that should adjust the lens, lose their elasticity, and the muscles no longer will change in accordance with whether the person's looking at things close up or far away. That's called accommodation. Your eyes will accommodate light or your vision of things close up or far away by changing the shape of the lens. And in presbyopia, you can no longer change or adjust the shape of the lens to accommodate near vision versus far away vision. And again, can be corrected by glasses. Now, with this one, the person ends up having to wear something like bifocals, so that they have lens in their glasses to correct both near and far vision. Okay, the next disorder to talk about is nystagmus. In nystagmus, the person's eyeballs literally wiggle back and forth. Involuntary, repetitive, rhythmic movement of one of the eyeballs or both of the eyes. Could be congenital, a person could be born with it. Needs to be checked out at an early age to be sure there's nothing more serious going on there. Or acquired. Acquired nystagmus is due to medications or drugs or alcohol that a person may take. Even brain damage or brain lesions could cause nystagmus. So it needs to be investigated to be sure about what the underlying cause of the nystagmus may be. And of course, if it's some very serious condition like a brain lesion, then the treatment of the underlying lesion is the treatment that's necessary. Okay, strabismus. If you look at strabismus in your textbook, it tells you that it's a visual defect of misalignment. Failure of the eyes to look in the same direction at the same time. Now there's two different forms. One form is esotropia, where one of the eye turns inward and the person appears to be cross-eyed. And then there's exotropia, which is sometimes called wall-eyed because the eye looks outwards, away from the nose in the other direction. The main thing is that both eyeballs do not look in the same direction at the same time. Now with strabismus, the person will often develop amblyopia, which is called lazy eye. So this is common in children, somewhat common. If it's going to occur, it usually occurs in children. It's a weakness of the muscles. The strabismus is the weakness of the muscles, but because of the strabismus, if this is not corrected at an early age, the person will become blind in one eye. A person that has strabismus and one of their eyes is looking outward while one eye is looking straight, that's very uncomfortable. Or maybe one of the eyes is looking towards the nose while the other eye is looking straight out. That's very uncomfortable, and the person's brain over a period of time will turn off the vision to the nerve to that eye that's looking the wrong direction. And I'm using the term lightly, turn off the vision. The nerve eventually will not work. That optic nerve to that eye that is looking the wrong way, that optic nerve will begin to no longer function. This has to be corrected at a very early age, but the correction is that the person will wear a patch over that bad eye. I said that wrong. They'll actually wear a patch over the good eye, and they'll be forced to begin to see through the bad eye that has been corrected with surgery. The surgery will correct the muscles. The surgery will make the eyes look both in the same direction. But to force the body to begin functioning again with that optic nerve, the person has to have something to temporarily blind them in their good eye and make them start using that bad eye that's now been corrected by the muscles. So this is strabismus, which includes esotropia and exotropia, and leads to amblyopia. Lots of opias there. Opia means vision. So the correction would be surgery and then some follow-up treatment. It needs to be corrected by the age 7. or they'll be unsuccessful in ever using that eye. Though the muscles could be corrected, they won't get the optic nerve to function again if it's after age 7 or 8 when it's corrected. All right, we're going to skip a couple conditions over to blepharoptosis. The word part ptosis means drooping. Blephar means eyelid. So this is a drooping of the eyelid. And truly it may just be kind of a cosmetic problem that the person doesn't like the way they look because one of their eyelids are drooping, or the eyelid may droop so much that it partially or completely blocks vision in that eye. Etiology is weakness of the cranial nerve or weakness of the muscle of the eyelid. There's also several diseases like muscular dystrophy and myasthenia gravis that may actually cause this drooping of the eyelid. And there is an operation that can be performed, but it's not going to be very successful if the person has an underlying very serious disease like the myasthenia gravis. Next is conjunctivitis, which is much more common. Itis, is inflammation. Inflammation of the mucous membrane that covers the anterior part of the eyeball and lines the eyelids. And the inflammation causes the eye to have a pinkish color. So when a person has conjunctivitis, they're referred to as having pink eye. And the pink eye that's due to an infection is actually a transmittable disease that a person may transmit their conjunctivitis infection from them to another person with contaminated fingers, or even using a washcloth and someone coming behind them and using the same washcloth. It's very important that proper hygiene procedures are in place when someone has an infectious case of conjunctivitis. And then there's also the conjunctivitis in which the person is having an allergic reaction or just an irritation from smoke. Treatment depends on the cause. If it's infectious and it's bacterial, then bacterial eye drops can be used. If it's allergic, some allergy medicine can be used. Okay, next, the disorders of the globe of the eye. I'm skipping over a couple of these and looking at the term cataract. The cataract is clouding of the lens. If you look back at the anatomy of the system and see the position of the lens should be crystal clear because light should be focused through the lens, and the lens actually change shape to accommodate the light from different angles. When a person has cataracts, their lens have clouded with, it's a substance that just appears to be like looking through dirty glass. You hope that if you have a window to look through, it's crystal clear, you can see through it. When there's a cataract, the vision's decreased because the lens they're looking for is cloudy. Now, many cases of cataract occur just because of the aging process. Cataracts could occur because of an underlying disease like diabetes. There's certain medications that are more likely to cause a person to develop cataracts. A person can live with the cataracts, but when the cataracts start interfering with lifestyle, interfering with driving, for instance, then they may have surgery to have the lens removed. And they usually have an artificial lens implanted so that they can still have the benefit of having a lens in their eye. And they also you have to wear glasses because they've lost that accommodation with the lens, with the natural lens. Glaucoma is the next condition to look at, which is a damage to the optic nerve caused by elevated intraocular pressure. Intraocular, inside the eye. The pressure inside the eye when a patient has glaucoma is due to a buildup of fluid that, as the fluid builds up, pushes the eyeball backwards and puts pressure on the optic nerve. And over a period of time, the optic nerve will be so damaged, it will be irreversible damage and result in blindness. There's a couple of different types of glaucoma. We're going to look at the chronic open angle and the acute angle closure. In the chronic open angle glaucoma, the person doesn't have any symptoms. It's what's referred to as a silent disease. It's the most common form of glaucoma, and it's the most treatable cause of blindness. If this is identified early enough through a visit to an eye doctor, an ophthalmologist, the person can have this diagnosis and then begin using eye drops to prevent further damage to the optic nerve. But the important part is that there are no signs and symptoms until the person has lost their vision, till they've lost the acuity of vision and their optic nerve is irreversibly damaged. So a person needs to go to an ophthalmologist to have the pressure in the eye measured to determine if they have glaucoma. In treatment, again, there are medications used to treat the glaucoma. There's also surgeries that can be done to help drain the fluid from the eye to release the pressure. The other type of glaucoma to look at is the acute angle closure. This is the type that's usually associated with eye pain and headaches, redness of the eye. So the patient usually has some warning signs of this type of glaucoma. But unfortunately, once the person truly has these symptoms, they become worse. Again, treatment can be done, which is an iridotomy that creates a small opening in the iris and allows filtering. Sometimes medications can be used and sometimes laser treatment. Eventually, let me say laser treatment. Eventually, they're going to have some actual procedure on the eye. Untreated glaucoma is a major cause of blindness. And now macular degeneration. I have a picture on your PowerPoint slide, if you look at that, that shows a person that has macular degeneration. It shows the way they see. The center of their visual field that should be the most crisp and clear actually is not showing up as the macula of the retina actually degenerates. So the blindness begins as a dark spot in the middle of the visual field and then spreads outward. Macular degeneration is usually age-related. There are some medications that will cause macular degeneration, though. Some genetic factors. If your parents had macular degeneration, you may very well develop the degeneration yourself. Treatment is tough. There's no definitive treatment. There's no real absolute cure for macular degeneration. Next is the diabetic retinopathy. And as you see in the name, it's caused by diabetes mellitus. The effect of the diabetes mellitus and the high blood sugar that goes along with the diabetes and the lack of the sugar getting out to the body cells will actually cause the retina of the eye to have microaneurysms, very tiny areas of bleeding behind the eye, dilation of the veins, abnormal new vessels will form. This will eventually lead to a decrease in the clarity of vision, and glasses will help for a while, but it's pretty common that someone with diabetic retinopathy will eventually, if they live long enough, suffer from true blindness. It occurs most often in the diabetics who do not control their blood sugar levels. Everyone with diabetes is susceptible, but certainly everyone with diabetes is taught to control, or should be taught to control diet and exercise and monitor their blood sugars and take their medication as recommended. And if they do not, diabetic retinopathy is one of the long-term complications and blindness. Retinal detachment. If you take a look at the normal eye, the retina should be attached to the back of the eyeball. Like I said earlier, this is where the nerve cells of vision are located. In retinal detachment, the retina literally detaches from the choroid layer. The person will have, they'll see these light flashes and what they describe as floaters. And if you ever see these light flashes, it's a reason to go to a doctor for an eye exam. And the doctor can detect, using an ophthalmoscope, the retinal detachment, and surgery can be performed. If you look under treatment, early treatment is advised. Intervention is imperative. Treatment will be either photocoagulation or surgery that's called a scleral buckling. That kind of just reattaches the retina there. But irreversible blindness can result from the untreated retinal detachment. A person may also have a detachment because of an injury. And then there's some cases in which the etiology is unknown. People that are extremely nearsighted are more likely to have retinal detachments than other people. Okay, we're going to skip a condition and then look at exophthalmos. And the picture really tells the story in exophthalmos. We've got protrusion of one or both of the eyeballs. Exophthalmos is a condition that's actually associated with a thyroid that's overproducing thyroid hormones. If you remember from the endocrine system, hopefully you do, Graves' disease is caused by the hyperthyroidism. Exophthalmos is a symptom of Graves' disease. So the treatment depends on the cause. Okay, this is the conclusion of part 1 of chapter 5.